I think we've realized that in premenopausal women who are still menstruating after their chemotherapy, there's clear benefit to ovarian suppression, and then adding on, say, tamoxifen or an aromatase inhibitor. And there'll actually be updated data will be presented tomorrow here, as well as San Antonio next month. Again, looking at the long-term benefits of that strategy. And so I think a lot of us are really starting to use it in those women who continue menstruating after their chemotherapy for early-stage breast cancer. I think that one of the major side effects that occurs from stopping someone's menstrual cycle permanently or semi-permanently is that you get an abrupt decrease in estrogen, which leads to enhanced bone loss. And we've known this is going to happen for a long time. We've known it with aromatase inhibitors, that even reducing estrogen a little bit with long-term aromatase inhibitor use can lead to substantial osteoporosis. For example, in the MA17R trial, where people have aromatase inhibitor suppression for 10 years, the risk of osteoporosis, of serious osteoporosis, goes up probably almost by in relative terms about 50%, in absolute terms about 5 to 10%. So it is a serious problem. And so we have drugs, that have clear benefit in reducing osteoporosis, oral bisphosphonates, intravenous bisphosphonates, and again, the debate really is which of those two bisphosphonates is better. I think they're probably about the same. How long to give them, whether it's 2 years, 5 years. There'll be data at San Antonio this year about that. And the last thing is whether denosumab, osteoprotogerin mimics, actually do the same thing, and it looks like from the data that we've seen that they kind of do. And so I think that the real question at this point in time is, number one, what biomarkers we have for response to a bisphosphonate, other than bone turnover markers really are very not the greatest markers to use. Is it someone this is postmenopausal and has a negative T-score? That seems to be the best biomarker, is the degree of osteopenia up front right now. We really don't have any, we only have a clinical biomarker, no molecular biomarkers. And finally, I think one of the things that we'll talk about tomorrow at the end is that these drugs not only prevent bone loss from ovarian suppression, et cetera, but in these women, they may actually improve survival. So overall survival, that's breast cancer specific, improves in absolute terms by about 3.5% at 10 years, according to some of the meta-analyses that have been done. So I think it's a pretty interesting area. It's not like a sexy new drug like a new antibody, but on the other hand, I think that by attention to some of these other things that we've been studying, I think we can still improve the overall outcome for a lot of women with early stage breast cancer.